Today, we're diving into a question that, let's be honest, has probably been on your mind. Why does it feel like everyone is getting sick all the time now? For a while, the simple answer was this thing called immunity debt. But, as we're going to explore, scientists are now looking at a much more complex and maybe even unsettling idea that involves the long-term effects of COVID-19 itself.
You've probably felt it, right? Maybe it's you, your kids, your coworkers. It just seems like every other week there's a new cold or flu or some other bug going around that just hits harder than you remember. Well, you're not imagining it. This is a real phenomenon that doctors are seeing in their clinics day in and day out.
And this quote from Dr. Samira Jamie, a clinical immunologist, really just says it all. She's talking about seeing infections that used to be super rare, and now they're popping up everywhere. It's not just the common cold. We're talking about weird flare-ups of old viruses and bacterial infections that are surprisingly severe. So, what on earth is going on?
Well, the first big idea that everyone grabbed onto was the immunity debt theory. It was simple, it made a kind of intuitive sense, and it gave us a straightforward answer right when we were all trying to figure out our new normal. And you can see why it was so appealing. The logic goes like this. For a couple of years, with all the masking and distancing, we were basically hiding from germs. Our immune systems didn't get their usual daily workout. So when we took the masks off and started mingling again, we had this debt to pay. All those viruses and bacteria came rushing back, and our immune systems were caught flat-footed. It made perfect sense. For a little while.
But here's the thing. As time went on and the sicknesses kept coming, the data just wasn't lining up with that neat and tidy theory anymore. The idea of immunity debt started to crumble as more and more questions piled up that it just couldn't answer.
Okay, so this is where the idea really starts to show some cracks. If it was just immunity debt, you'd expect one huge wave of sickness right after restrictions ended, and then things would kind of go back to normal. But that's not what's happening. The waves of infection just keep coming, year after year. And here's the real head-scratcher. Infants born after all the pandemic precautions were gone are also getting unusually sick. They were never shielded, so how could they have an immunity debt?
And the specific data just keeps poking more holes in the theory. You look at something like invasive group A strep. Its biggest spike was way after most precautions had ended. We're also seeing studies that show people who've had COVID are more likely to get bacterial infections afterwards, compared to people who've had the flu or RSV. And those infants we just talked about, they couldn't have an immunity debt. But you know what they were likely exposed to? SARS-CoV-2. All of this is pushing scientists to look for a different answer.
And that brings us to this new and pretty major hypothesis that's gaining traction. What if the SARS-CoV-2 virus itself is what's causing the problem? The idea that getting COVID, even a mild case, might be subtly changing our immune systems in a lasting way.
Now, to get our heads around this, it helps to look at another virus we know pretty well, measles. It's a known fact that measles can cause something called immune amnesia. It basically wipes out some of your immune system's memory, making you vulnerable to diseases you were already protected from. The new hypothesis is that COVID might be doing something kind of similar but through a different mechanism, maybe by causing, as one expert put it, an unusually high level of indiscriminate T-cell killing, which messes with our immune memory.
And this isn't just a wild guess. There's a growing body of evidence that's pointing in this direction. For instance, we're seeing much higher rates of dormant viruses, like the ones that cause mono or shingles, waking back up in people after they've had COVID. There are studies showing T-cell exhaustion and signs of premature aging in our immune cells, even after a mild infection. Some research even suggests the virus can get into our bone marrow and reprogram things, and that it can hide out in our gut for years, keeping our immune system constantly on edge. It's a lot of different puzzle pieces, but they're starting to form a picture.
Now, I have to be really clear about this. This is not settled science at all. The idea that COVID could be causing these kinds of widespread immune changes is a really hot debate right now, and there are very smart people on both sides of the argument. On one side of the debate, you've got prominent figures like Dr. Ashish Jha. His view is that yes, some people might have some immune issues after COVID, but it's a very small number, and the idea that it's a widespread problem affecting the whole population is just not supported by the evidence.
But then, on the other side, you have immunologists like Dr. Tim Henrich at UCSF. His research leads him to believe that, yes, there has absolutely been a population-level change in how our immune systems are working since 2019, and it's probably affecting our overall health. So, as you can see, the experts are far from agreeing on this.
So, you've got scientists disagreeing. Why should the rest of us care? Well, because the answer to this question could fundamentally change how we think about our health and the health of our entire society for decades to come.
And this leads to what might be the most powerful and, frankly, mind-bending idea of all, from immunologist Akiko Iwasaki. See, in a normal experiment, you have your test group and then a control group that wasn't exposed to the thing you're studying. But with COVID, almost everyone has been exposed. As she says, the entire world is now the study group. We're all living inside one giant, unplanned experiment, and we're just now starting to see the results.
So that leaves us in this fascinating, if maybe a little unnerving place. We started with a simple answer, immunity debt, but the real story seems to be so much more complex. The science is still unfolding and the debate is very much alive. But it leaves us with this one huge question, a question that could define public health for a generation. If this virus has subtly changed our immune systems, what does it mean for all of us in the years to come? This is Infectious Diseases TV. Please like and subscribe.